What makes aromatase inhibitors better for breast cancer hormone therapy? Imagine fighting breast cancer with a targeted approach that can make a real difference in outcomes. Aromatase inhibitors are a key part of hormone therapy for many women. They work by blocking an enzyme called aromatase, which turns androgens into estrogen. Since estrogen can fuel the growth of hormone receptor-positive breast cancer, lowering its levels can slow or stop the cancer from growing. This is especially effective in women who are postmenopausal because most of their estrogen is produced outside the ovaries, mainly through aromatase activity. Research shows that aromatase inhibitors are more effective than tamoxifen in reducing the risk of cancer coming back. They can cut the chance of recurrence by about 30% in postmenopausal women. They also help women stay disease-free longer and improve overall survival rates. Large clinical trials have consistently supported these findings, with studies like the ADAC trial showing that anastrozole, an aromatase inhibitor, provided better outcomes than tamoxifen. In premenopausal women, aromatase inhibitors alone are not usually effective because their ovaries produce a lot of estrogen to compensate. But when combined with ovarian suppression treatments, such as medications or surgery that stop the ovaries from making estrogen, aromatase inhibitors can significantly lower the risk of recurrence even in these women. This combination therapy is supported by clinical evidence and helps expand the benefits of aromatase inhibitors to a broader group of patients. While aromatase inhibitors are highly effective, they do have some side effects. They can increase the risk of bone loss and fractures, so bone health needs to be monitored during treatment. Some women may also experience cardiovascular effects. On the other hand, tamoxifen has different side effects, including a higher risk of blood clots and uterine cancer. Choosing the best therapy depends on individual health factors, tolerability, and personal risk profiles, which should always be discussed with healthcare professionals. In summary, aromatase inhibitors are considered better for hormone therapy in breast cancer, mainly because they more effectively lower estrogen levels in postmenopausal women. This leads to a greater reduction in recurrence and better survival outcomes. When used with ovarian suppression, they can also benefit premenopausal women. But, as with all treatments, the decision must be personalized, weighing benefits against potential side effects, and guided by medical advice. Always consult your healthcare team to find the most suitable approach for your specific situation.